Hello, today I will be showing my supplies and materials that will be needed for future assessments when assessing patients. First up, I have my stethoscope. This will be used to listen for sounds of the heart, making sure you're hearing that lub-dub sound and not hearing any murmurs or anything abnormal. Second, usage could be for GI sounds and also lung sounds. The next thing I have is my sphygmomanometer for measuring the blood pressure. Blood pressure cuff, the pressure that will show the numbers, and the bulb. Next up, I have a pulse ox that will be used to measure the oxygen concentration in the finger and also the heart rate. Yeah, as we learned, this red laser is essentially what helps figure that out for us. Next up, I have a tape measure that we can use to measure circumferences of the body, for instance, head, waist, any injuries that may need to be measured. So yeah. Next up, I have my pupil gauge for papillary light reflex. This is just to make sure that the pupils have even diameters, make sure that everything looks normal and checks out. Show any abnormalities with the eyes. Next up, I have this reflex hammer, and it has a sharp side and a dull side, and this is just to test for any neuro abnormalities, making sure the reflexes are all good. I have two vibration tuning forks. These will be used to detect sensory nerve function and just to make sure that the sensory nerves and everything is checking out correctly and that there's no abnormalities, especially any neuropathy. So unfortunately, the last tool, the 2-point discriminator, never came in for me. I did purchase it. I will include a photo that says I did purchase it about a week and a half ago, and it just still has not came in. So I will have to go ahead and repurchase that and get that settled with Amazon. But while I'm dealing with that, I will just go ahead and tell you about it and pretend I have it here. So that is just going to basically test the somatosensory and the peripheral nerves. And it is going to have 2 fine points and making sure that the patient can distinguish between the 2 different points and feel fine stimuli. Okay, first, do I have your consent to conduct these vital signs?
Yes.
Okay, I'm going to tell you 3 words that I'm going to ask you to repeat at the end. Ball, coffee, couch.
Okay.
Okay, now I'm going to get your pulse. Okay, that was 20. So for 15 seconds, that is 80. Okay, that was 40, so for 30 seconds times 2, that's 80. Starting in a minute. 83 beats per minute. Now I'm gonna use this pulse ox to check your oxygen and your heart rate again. Heart rate is 94, pulse ox is 99. Heart rate seems to be trending down. Okay, now I'm gonna go for blood pressure. Okay. Okay, that was 126/82, all within normal range. Are you in any pain right now on a scale of 1 to 10? 10 being you're in pain, 0 I'm not.
0 I'm not.
Okay, and what were those 3 words I asked you to repeat earlier?
Couch, coffee, and ball.
Correct. Thank you.